We can't talk about this case anymore.
I hear you're gonna need an incentive to get on my pills by tomorrow.
This is plan B.
House's ability to stay out of trouble is as well developed as a pair of seagull legs. Very excited to be reacting to House MD Season 8, Episode 120 Vicodin. On this channel, we are reacting to all 177 House videos, and this will be episode 156. Let's see if I can get the diagnosis before House does as a doctor working in London.
Are you sorry about what you did?
Yes. I'm just trying to give you the answers you need to cover your asses, fill out your forms, and let me out of here.
Shut up. We got an order to reduce overcrowding, so forget being sorry. Can you stay out of trouble for 5 days?
Yes.
House!
I'm starting to think, Mendelson, you just really like the taste of my spit.
Knight to King's Bishop 3.
Queen to King's Bishop 7.
I got these weird pains in my elbows and in my knees.
The clinic is a large room. Why are you stealing my stuff?
Hey, House. I've heard you're on short time.
Put it back.
Nuh-uh. You're just gonna let me walk out of here.
Get out alive on Friday. That was checkmate, right?
Yep. I want your stereo and your headphones. Drop it off in my cell.
99.9. I'm gonna start him on ceftriaxone.
It's not gonorrhea.
I've only been in here 1 week. My girlfriend's clean.
How do you know about ceftriaxone?
Doctors could be degenerates. This is America. There's subtle eyebrow loss. It's lupus.
There's no reason to search for a bodily rash since lupus doesn't usually present that way.
Usually, you don't write people up for mouthing off, do you?
Not usually.
Hey, Stomper.
Where's my stereo?
I brought it to your cell. Rolo, follow me in. He was all, I can take Stomper. How Diaz kicked his ass last month.
You took my stereo? Well, then what's this then?
What?
You gonna lie to my face?
That was stupid.
This is why you never steal from House. He may let you walk out of his cell with the tuna, but oh, you're gonna be due a salty snack. Interesting though how he just needs to keep himself out of trouble for 5 days and he's already managed to orchestrate a beatdown, checkmate a guy without looking at the chessboard, and upstage a prison doctor all in a day. Maybe he's wanting to stay a little bit longer. That certainly would be what the prisoner with the joint pain would want, as House diagnosed lupus from eyebrow loss. Really? Thin eyebrows means lupus? Might as well open a prednisone cart by the salon. Lupus could cause eyebrow thinning but should affect other hair as well. But there are other things that can, so what are they? Well, actual things that happen in the real world are natural hair loss with time, low thyroid levels, alopecia areata, which is usually triggered by stress, underlying skin conditions like eczema or psoriasis, or even nutritional deficiencies. None of those scream hidden doctor savant from the prison tops though, and we also need to account for the joint pain, so what else could this be? I have a theory. Our patient has just been in prison for the last 1 week, so where has he been before that? Could be hiding at the sea from police, but managed to get caught by the patrol boats. If he wasn't careful about his diet, he could have ended up with low iodine levels, and that can lead to hypothyroidism and explain his symptoms, including the eyebrow thinning. The treatment would simply to give him more iodine, at which point he'll be back to basics before Stomper is listening to Beethoven with his new stereo. Alright, iodine deficiency is my first diagnostic guess. Let's get more clues.
Take off your shirt so I can find the rash. Lupus Boy and I were at the beach this morning, and I noticed a rash on his left thigh.
You were a pretty big deal. Why are you so sure I'm gonna do what you say?
It's your liberal ideology makes you want to make a difference. You're both rich and liberal. The only time you haven't looked bored in the 3 months since you've been here is when we've been discussing this diagnosis. Treat him for lupus.
On short time, tax goes up.
How many do you want?
All of them.
It's 11 in all.
I count 20. You do on Monday, you get out Friday, 5 days. Should've told me earlier. Unlike you, I got friends on the outside.
Got some new girly mags too.
I was thinking of something more Vicodin-y. At least 16.
I'm gonna have to clean you out. I'm gonna need to see some tuna. I'm gonna need to see some stamps.
Just bumped into the wall. It's not lupus. It's not lupus. He broke his arm, yellow fingers.
You're thinking lung cancer. Metastatic? I'll x-ray him on Friday.
Start him on blood thinners.
Harry, no need for proof?
She doesn't want to talk to me.
Please. I'm trying to listen to your lungs, not your self-pity.
Whoa, 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 so let me get this straight. House thinks this patient fractured their arm from a slight bump, did so because of lung cancer that was spread all over his body, has no evidence of what is going on, and wants to start blood thinners. What? He could already be actively bleeding into his elbow, and all this would do is make that way, way worse. We're also losing accuracy points here, not just because of the treatment option, but I know for a fact that when prison patients get sick, they are frequently transferred out of hospitals for treatment with guards. I know that because I've treated many of these patients, one of which had to be handcuffed to the bed so that he wouldn't attempt an escape. So there would be no 3-day wait for an x-ray if a broken arm was suspected, even though the x-ray was to try to look for cancer, not a fracture. Even with a smoking history, this chap is relatively young, which doesn't put cancer high on the differential, even though it can happen. So what else could this be? Well, we know he's a smoker, his elbow pain is getting worse after the minor bump, he's also deteriorated in the last 1 week while in prison, and he has a weird rash on his thigh from what House has mentioned. I actually have such a good theory here. It seems these prisoners have access to all kinds of things that they shouldn't have, so somebody must be smuggling these in. Maybe as a newbie he was sent outside to do this and had to sneak through some bushes and then got himself a tick bite. The rashes on his thigh then developed and he's got joint pain because, drumroll please, he has Lyme disease. It is frequently missed and misdiagnosed and could be treated with a 2-week course of, say, doxycycline for a full recovery. It would fit his symptoms and can cause hair thinning through a related condition called telogen effluvium. Oh, it's perfect. All right, I'm going for Lyme disease as my second diagnostic guess. Let's see if I'm right and how House is going to get his hands on more than his allocated Vicodin for Mr. Prison Boss.
Confederates would give themselves spanking new tats. They put in a claim on all my Vicodin.
It's called an acoustical shadow. Means he's got a tumor.
How did you find that without a stethoscope?
Start the blood thinners.
All you've proven is there's an anomaly in his chest. I could do a clotting test. We're just gonna cut your earlobe a bit and check back in 2 minutes. If it's completely clotted, it may indicate cancer. Are you really leaving medicine? You have a gift. You can read people. You understand them.
Hey, is this supposed to happen?
The acoustical shadow was just lipoma. You can look at the patient file if you want. If we add clotting disorder to the symptoms, it's got to be a toxin.
This guy's the only one with symptoms.
So maybe solvent or detergent.
Why does this man have a file?
Why did you lie to me about what you were in for?
So I drove a car into a wall instead of stealing some pills.
I feel stupid. Why are you doing time? You didn't have any priors. You didn't hurt anyone.
I had a bad lawyer.
We can't talk about this case anymore.
I hear you're gonna need an incentive to get on my pills by tomorrow.
This is plan B.
House's ability to stay out of trouble is as well developed as a pair of seagull legs. It seems this is also episode 57 of him being thrown off the case, except it's now being done in an arena where he has no power, and prison chief Nelson over there is taking every advantage of that. The patient will have no plan B himself though if House is released without cracking his case, so what else could this be? Well, the newest clues we have are that he kept bleeding on the test and that the lung problem House picked up with no stethoscope is actually just a fat lump. That means House's cancer theory goes out of the window and they are now suspecting toxins due to the bleeding, but he would have to be the only one exposed considering his symptoms. I have another theory. Since this patient was a drug dealer, then maybe he's also continuing his work inside, but has a lower quality stock. That means that he's being exposed to types of cannabis that are lower quality and contaminated with super warfarins like brodifacoum. The joint pains could be due to bleeding in the joints or skin, and similar with the rash, and it would cause his clotting to be off for the bleeding test. Treatment would be a combination of avoiding contamination and some vitamin K, and he'll be back to normal before House can use his pen. Alright, I'm going for superwarfarin exposure as my third and final diagnostic guess. We are locked in.
What is it? Your lips are swelling.
Did you just eat something?
You allergic to anything? I gotta make a hole so you can breathe.
Alice, get away from him!
He's having an allergic reaction. Come on, man. You know I'm a doctor.
I need to be taken into protective custody.
You don't need PC.
It's nothing personal. We'll reschedule. It was the heat. It's mastocytosis.
It fits.
I'll run some blood tests. Thank you.
No. Just give him 5 aspirin.
I'll do it. You're done here. Just like every other place you've ever set foot in your life.
I talk to prisoners I know about exit taxes. You're clearly getting squeezed.
I need 20.
Well done. And the smart thing is to fall in line.
You're absolutely right.
Take him out.
Where's the aspirin?
Did you get beaten up on purpose? You had no lawyer. You took the first deal they offered you because you wanted to punish yourself.
You should get an attack almost immediately. That is, if I'm right.
Just drink it! Drink it! No! Wrap this up! No!
You're fired.
Now shut up and let's see if he has an attack.
Come on, just a little more time.
Get him out of here.
Oh, mastocytosis! What a diagnosis! I love how the satisfaction of a cracked case for House is worth more than his freedom as well. So well written. I mean, in theory, an allergic condition would cause the joint pains and rash, although the rash would be more widespread and characteristic looking like hives. Mastocytosis is different from MCAS or mast cell activation syndrome because the amount of this allergy causing immune cell is higher rather than them just being more prone to be activated. This aspirin test is also stepping into medical fiction, as in some cases it would do nothing even if the patient has mastocytosis. Still very interesting and loving the prison dynamics. 8.2 out of 10 entertainment, 8 out of 10 diagnosis, 7.3 out of 10 accuracy. This episode makes way more sense if you watch the previous one where we find out why House has landed in the slammer in the first place.